Good evening. So tonight we're going to be putting matters of the status of the country in regard to cancer prevalence. Statistics indicate that at least 9 persons women especially, lose their lives on account of HPV, that is cervical cancer, while 9 out of 10 those who contract or cervical cancer actually succumb to the disease. Tonight, the status of matters of cancer are going to be put into perspective, and our guest tonight is none other than Dr. Miriam Mutebi, who is the chairperson of the Kenya Society of Hematology and Oncology, abbreviated as KESHO. Thank you very much, ma'am, for your time.
Thank you.
Let's start out from there. Let's know, where are we as a country when it comes to cancer prevalence?
So I think one of the first things that we do need to keep in mind, Regina, is we are actually in the middle of what we call a syndemic, which is basically a constellation of very many different pandemics. We've just recently come off the COVID, and we're seeing an emergence of both non-communicable diseases and cancer especially. And if we look at data from the recent Commission on just cancer in sub-Saharan Africa, what we do see is that over the last 30 years, our numbers have doubled. And what should be more alarming is by 2020, if we look at the numbers, we saw that 500,000 Africans died as a result of their cancer. And what should really give us a call to arms is that if left unchecked, this number is likely to double by 2030. Sort of circling closer to home, we see that the patients who are diagnosed every year tend to be around about 42,000 patients. And again, what we do see as well is a very high, what we call incidence to mortality ratio, meaning that patients who are diagnosed die from their cancer. So we see about 27,000 deaths. However, at any one time, we have about 82,000 patients living with a diagnosis of cancer. And I would say in the last 10 years or so, we have seen considerable increases in terms of availability of cancer services. I think we do need to acknowledge the couple of strides that have been made over the last 10 years. One, we have a very rich policy as relates to both the defining screening guidelines, treatment guidelines for cancer patients, and more recently over the pandemic, we have recently launched a palliative care policy, and palliative and supportive care. We've seen an increase in the number of cancer services available. We've seen a development of both regional centers that provide cancer services, whether it's surgery, chemotherapy. We now have 11 centers in the country where one can receive both surgery and chemotherapy. And we've seen an expansion or decentralization of radiotherapy services. What used to happen 10 years ago is everyone across the country would have to go to the main tertiary referral in Nairobi at Kenyatta
to receive. That is the Kenyatta National
exactly.
Hospital. Now this has been devolved, somewhat devolved to the region.
Precisely.
Maybe